Hey, so this is a pretty special day today. 2 weeks ago, we got some pretty exciting news. We took Lucy in for a glucose curve test, and when we came in to go pick her up, they told us that her numbers were fine and that we could wait 3 months before having to bring her in for another glucose test, which was pretty exciting because we've done the every other week thing, and then we started doing 1 month out, and then we'd have to go back to the every other week while increasing her insulin every time, of course. And finally, this time, we got the you don't have to come back for 3 months, which was super exciting. And we got a referral to go get her eyes actually fixed from her cataracts. So today's that day that we do the consultation. We're pretty excited. There have been a lot of tears. Even this morning when we were getting ready, we both almost busted out because we're so excited to get Lucy's vision back. Even still, with all the excitement and me being so happy to have her back where she can get herself around on her own and be able to just see and enjoy life like she used to, have a better quality of life, I can't help but to hope that I'm doing the right thing. At the end of the day, this is a surgery on her eyes. She's going to be put under. She's going to have her eyes cut in some way to clean the lens and whatever they have to do. I don't know a whole lot about the surgery. I'm going to learn more today. There's so many things that could go wrong. Like, it might come to a point where she just needs to have her eyes fully removed, which is going to be really upsetting for me. But if that's what needs to be done, then that's what needs to be done. It could be she never wakes up, which has been like my biggest fear. I'm just hoping for the best. So we were running late, so we had to run right in there.
Yeah, I didn't have a whole lot of time to set up a shot or anything like that, sorry.
Yeah, a lot of information was told in that time. We actually are leaving her here for a couple of hours.
To get more testing done to move forward in the process.
Yes, and expensive testing. We won't talk about price, though.
If you plan to do this, just be prepared to reach
to spend
deep.
The money. Yeah. But she had a couple of tests right off the bat where we checked her eye pressure and checked her reactivity to light and something else too. I don't remember. Oh, the tears.
The tear production.
Tear production. And right now she's looking like a good candidate for cataract surgery.
The testing she's doing right now is to make sure that there's no damage behind the eye that they can't see at the moment. Due to the matured cataracts, they can't just look at it. So you gotta do like an
ultrasound on her eye, which is interesting.
And so that's what they're doing right now. And that will tell them more what's going on behind the eye to make sure there's no damage that would prevent us from going further. Right now, from what they can tell, we're good. We're solid. But this is just to make absolutely sure, because we don't want to risk the pet with going under anesthesia or anything like that if there is damage that would otherwise be a problem. So it's going to be a little bit, but I think overall I feel confident they know exactly what they're doing. There's no question their knowledge.
And honestly, by the sounds of it, I think it's actually going to get done.
And
okay, go ahead.
And the best news that we got out of all this is if we do proceed and everything's a success, there's zero chance of it coming back in the future. This is a one and done event. Which we were worried about, that if somehow something happened and we missed an injection, would this happen all over again? But it won't. This is
once it's done, she cannot get
cataracts in her eyes again from the diabetes.
Which is really good news. And for the record, I actually held it together pretty good in there. Up until the last bit where, what did she say before?
She's talking about how when a pet comes out of it and they just look around the room and just kind of just baffled and shocked by the fact they can still see now. Because they were confused at why they couldn't see and now they can.
And the lady was telling us all about how it was such a great experience being able to see them come out of it like that, and I'm like,
it's very rewarding.
And from that point I just kind of lost it.
It was like a dodo episode.
We're gonna try to go amuse ourselves for a couple hours.
Try and take our minds off of it and just hang out.
And then just wait for a phone call, which I gotta turn my volume on, to come back and go over the results and pick her up, and hopefully we'll get good news that we're good to go and set up an appointment.
They said that we could have an appointment as early as next week potentially, But the sooner is the better, so we're going to try and do that as soon as possible.
Yeah, because they prioritize dogs with diabetes just because it can become so severe so quickly. So the sooner we get it done, the better.
And it's possible, even at this stage right now, something could happen if we wait 4 months out that would make her no longer a candidate for the surgery. So we want to try and take care of that now rather than later.
Yep.
Really good news, and I think we're pretty excited about it.
Yep.
Our baby's going to be able to see again.
Yep. Don't do this to me. I'm gonna calm down. And we're gonna go find something to do, so.
Probably food. I'm thinking food.
You want food? Let's go get food. Alright, so we wandered around a mall somewhere for a little while, and then we came back and got our baby girl. She's in the back seat right now, being a good girl as always. And her numbers were phenomenal. So we are proceeding with surgery. It will be happening in 2 weeks.
Roughly. From the time of recording, obviously.
Yeah, on the 6th of February, basically. So we're pretty happy about that.
It's always good when you go into a doctor's appointment like this and they said everything is good news. Like, that's always positive. Like, that was the starting point.
Yeah. We have a bunch of eye drops we're going to be giving her over the next few weeks, as well as some prescriptions like 3 days prior to the actual surgery. So
just stuff to get her ready for surgery and to help the pre-surgery part, and then we have stuff for after as well. Mm-hmm. So it'll be a little bit of a regimen.
Yeah, but
we have to be strict with it.
The plus side is we're already on a regimen for her because she does have diabetes, and we do have to give her insulin twice a day. We are hoping to take the week off after her surgery, so we're home with her the entire first week, especially since that's the time when we're going to be giving her multiple eye drops throughout the day.
And also have to watch to make sure she's not doing things like jumping off furniture or playing with toys that work the jaw muscles, because that can increase blood pressure in the head, which can complicate issues with the surgery itself.
Yeah, so it's a lot of just being gentle with her, taking care of her, which, I mean, we already do anyway, but
just being more so, because anything that can cause her to be riled up or increase blood pressure could cause issues, and we don't want that. She's been through enough. So we're gonna keep her calm down and have a chill time.
Yep. So that being said, let's skip to surgery day. Well, it's surgery day and we're here, and Lucy is inside and getting her initial testing done to make sure she's still good to go. We're just kind of waiting around. It's gonna be a long day of us just waiting. We had to drop her off at 7:30 in the morning. It is currently, I don't know, like 8, I think, 8:30.
8:40.
8:40, and surgery estimated around 10 o'clock. Well, putting her under around 10 o'clock. Surgery will take about 2 hours or so. Then they hold her for an hour afterwards just to make sure she's all good, her pressures are stable, stuff like that. After that, we'll get some consultation stuff to show us aftercare, whatever. And then we get to go home finally, which is probably going to be somewhere around 2, 3 o'clock by their estimation. So, like I said, we're just going to kind of wait around. We might hang out in the car. We might hang out inside. We didn't get a whole lot of sleep last night, so there's probably going to be napping in the car for a little while.
At this point, it's out of our hands, literally.
Yeah. So,
there's nothing more we can do, and we won't be able to see her again until she can see us. So
don't do that stuff to me. I'm not going to lie. I've been on a bit of an emotional roller coaster. Like, I'm scared. I'm worried. I'm nervous, but I'm excited too. I'm really ready for her to be able to see again.
I will say, through this whole process, she has not lost an ounce of her energy, her energeticness, like any of her spunk or attitude. So this has not slowed her down at all. It's just gonna help her be a little happier and have a little higher quality of life.
Yeah, it'll be good.
Not see so many shadows.
So anyway, we're gonna let the process do its thing and
trust the whole process, trust the universe, trust the doctors, everyone that's assisting with it.
Let my stomach churn all day.
Everyone there seemed really confident. They seemed really intelligent, really well educated with everything they're doing.
Very enthusiastic about their job.
Absolutely. So I have really good hope, really good vibes. We wouldn't trust our baby to anyone if we didn't have good vibes. So
yeah. So anyway, I guess we'll come back with a visual on how she did.
We'll let y'all see.
So we just got done. I am the most stable I have been since getting my loose back.
We have her back now, by the way, in case you can't tell.
Yeah, and her eyes are what they're supposed to be. I mean, obviously she's got, like, where her incisions are and stuff like that, but she's looking around. Again, I've been hysterical since I've gotten her back because I'm just so happy.
So she's gonna be a little emotional. Bear with us. She's just so happy that her peepers are peeping again. So this is really incredible. The difference between her eyes before and after this operation is really just, it's mind-boggling, the difference. Like, this is what she looked like a year ago before all this stuff happened.
Yeah.
Like, it doesn't even look any different than the other day, or than a year ago.
Yeah.
But she went from having basically cottage cheese in her eyes to being able to just be normal again, and that's just, it's a miracle almost.
So we're gonna bring our dog back home now.
I made up driving.
Maybe. I'm starving. We haven't eaten since breakfast, so it's been an all-day process at this point.
We've been here just in case anything ever happened. We weren't gonna take any chances.
And so, yeah.
Nothing happened. It was perfectly normal, uneventful. That's the best news we could have got.
So, anyway.
She did get both lenses put in place, so she does have perfect vision. There is no compromise
she doesn't have perfect vision right this minute. It'll take her a couple of days for her eyes to re-regulate because of the things that they use in her eyes. I can't even explain it right now.
Plus the medication that keeps things dilated and stuff like that.
Yeah.
So her vision right now is still not perfect, but when it heals, it'll be back to what it was.
Yeah, which should only take a couple of days. It could take more than a couple of days, but in most situations, it should only take a couple of days, and she should be back to normal vision.
So as long as everything goes well, it'll be great.
Yeah. So we've got an appointment tomorrow just to make sure there's a certain medicine that they use that's got to wear off, I guess, and they want to make sure that's good as well as check to see how her 24-hour progress is.
Make sure nothing's clogged up or blocking like it's not supposed to be.
And
make sure no infections are starting up or anything like that.
Then we'll have a 1 week, then we'll have, I think, a 1 month after that. So for right now, I just want to get some food and go home and start her eye drops that we need to start. So.
And snuggle her like you've never snuggled her before.
And be hysterical a little bit more to get it all out of my system. Because it's been a little rough. A little rough on dog mom over here. So, anyway, I guess we'll cut till tomorrow. Give you the update about tomorrow.
Hopefully a little less tears, a little more consistency here, a little more level.
So, alright.
We'll see you in a little bit.
Alright, so it's the day after surgery. We came back for our
1 day checkup.
And it looks amazing. She's doing amazing. She's still in her cone of shame.
She's handling it well, though.
She might have a little green in her eye right now because I put some green dye in there so they could see inside the eye better.
Make sure there's no damage or scarring of the actual cornea itself.
Yep.
And she's good.
Yeah, we had a little bit of worry last night because she actually did have some white patches in her eyes, but I guess those are normal.
It's due to the hyper mature cataract. There's a little bit of wrinkling of the actual lens bag itself, and because her eyes are dilated because of some of the medications, we can see that. They couldn't get rid of that without removing the whole bag itself.
And if they did that,
she wouldn't be able to get the lens implant, and then she wouldn't be able to see up close. She'd be very farsighted. So while we can see the scarring right now, it's perfectly normal. It's okay. And as we discontinue the medication that keeps the eye dilated, it'll actually shrink back up, and we'll never see it again, and she'll look normal. So
I guess we're good to go. We're gonna head back home, and we'll see you in our 1 week checkup and let you know if she's still doing good.
Yeah, it was nice to hear the actual surgeon person talk about how the surgery couldn't have gone any better. The whole operation was like as easy as it possibly could have been right from her. So that was nice to hear. She's our little star trooper, man. She keeps getting bragged on.
That's such a cute face.
She's the bestest.
Unfortunately, we didn't record anything at our 1 week appointment due to me completely losing my voice. I will, however, let you know that the appointment went well and everything looked great. The only issues we had during the first week was a little bit of a hard time getting her to eat. We ended up having to get her an appetite stimulant, which mostly worked until it was gone. Even now, after her 1 month appointment, she still hesitates to eat. But her and I have come to an agreement that if I hand feed her, she will eat. Speaking of her 1 month appointment, let's go to that. So hopefully today is the day. You'll have to ignore my voice. I don't have much of one right now. But we're about to go in with Lucy and our 1 month appointment. And hopefully when we leave here, she shouldn't have a cone on anymore. And I'm sure she's very excited.
She's acting pretty excited this morning.
Yeah, I almost think she knows what's going on because she has been like ready to go. Like, let's go in the car, let's ride. And she's not usually a big car ride kind of dog, but man, she was ready to go today.
She's been way more hyper today than she has been like the entire last month. Maybe even like last year.
I guess we're gonna head in. We're gonna figure out what's going on at this appointment, make sure her eyes are good, and hopefully we'll walk out of here without a cone.
And maybe some less medication.
Oh yes, and less medication. Guess who doesn't have a cone? See? Supposed to look more happy about it.
Regardless of what she looks like, I swear she's happier without it.
She really is. She was excited the whole time.
Yeah.
So.
She's full of energy today. Like, so now it's even more so that the cone's actually off.
Yeah.
Got a big old smile going.
Yeah.
She's running around kind of everywhere.
How happy you are. Anyway, so although this might be the end of the video, it is not the end of her process. Obviously, we still have to keep up with her diabetes, with her insulin. Obviously, we still have to keep up with some more eye drops and stuff. We have another appointment coming up in 3 months.
3 weeks.
3 weeks.
No, wait. 6 to 8 weeks.
It'll be the 3 month.
It'll be the 3 month mark from the surgery itself.
Yeah. So, although that's still ongoing, so we're gonna go to that, and then after that, it should be every 6 months.
And as of right now, we were right. We do have a reduction in medications. She only has 2 drops in the morning and 3 drops at night.
Yep.
And no more pills.
No more.
Well, 1 pill.
Yeah, 1 pill.
1 pill in the morning, which is way more doable than what it has been, the regimen.
Yeah.
So I'm pretty happy about that. Less things to worry about keeping up with and traveling with.
Yep. So, and hopefully, whenever we go to the next appointment, she should be down to just 1 eye drop a day.
1 eye drop medication twice a day.
Twice a day. I know long run we're supposed to get down to where it's just once a day. I don't know when that'll be, if that will be at the 6 month point or not.
I don't know. It'll all depend on how she heals and everything. But as for right now, the way it's reducing down has been really nice.
Yeah. I mean, we're doing a good job. We're doing our due diligence.
She's doing really good, healing up real well. Pressure, the ocular pressure was really good, 17 and 16, which we're told is like right, perfect where we want to be.
Yep.
So
yeah. Anyway.
Good news.
Good news. I know this isn't our typical content, but we figured it'd be a good update video. And we figured we'd take you through the whole process. So
just kind of share with you what we know and as we go along with it.
Yep. So we hope you guys have a lovely rest of your day. We hope to see you in a couple of weeks.
Hopefully maybe at a property rental or something.
Yeah.
Get back to that. But anyway, thank you all so much for watching. Have a great day. Be safe.
Bye.
See ya. Oh, you can't see it. This side.
I've seen a lot of change, been through a lot of pain. Some things are not the same as they were a year ago, but all will be okay. I move on each and every day. The past is where it stays, way back a year ago.